did want to mention we're very excited about what you're doing, longevity and prevention. You're a leader in this area, in this region, and we're very excited. I hear that from a lot of your patients, frankly. So you're up.
Well, Mr. Chairman, ranking member, and distinguished members of the committee, I'd like to thank you for this opportunity, first of all, to speak to all of you guys. I want to begin with a story. It's a story of a little African-American boy growing up in a small country town in Virginia with one stoplight. When he was just 7 years old, the little boy faced a life-threatening health crisis, and his appendix ruptured, and the complications nearly took his life. He was hospitalized for weeks with tubes coming from every orifice of his body. It was terrifying. But because of the two noble surgeons, Dr. Teague and Dr. Gaylord, he survived. And during that illness, lying in that hospital bed, that little boy made a decision that would shape the rest of his life. He decided that one day he would become a doctor so that he could care for others the way those doctors had cared for him. Obviously, that little boy was me. Fast forward 30 years. After 4 years of college, 4 years of medical school, 3 years of residency, 1 year of chief residency, 2 years of NIH fellowship, 2 years of cardiology fellowship, and a year of interventional cardiology fellowship, I had achieved that dream. I'd become an interventional cardiologist. I was in the cath lab opening blocked arteries, treating heart attacks, responding to cardiac arrests, saving lives in the most critical moments. But by every traditional standard, I'd made it. Mission accomplished, or I thought. Because after about a decade of practice, I began to notice something deeply troubling. Too many of the same patients were coming back through the revolving door of our healthcare system with the same chronic illnesses, the same preventable complications, and the same fear. That's when I had to confront the hard truth. I was not truly practicing healthcare. I was practicing disease management or sick care. I realized that our system is incredibly advanced when it comes to treating illnesses. After it happens, we have a remarkable technology. We perform extraordinary procedures. We can do things in medicine today that would have seemed miraculous just decades ago. And yet, despite all of that, Americans are getting sicker. Chronic disease is rising. Metabolic dysfunction is rising. Cardiovascular disease remains the leading cause of death. And perhaps the most concerning of all, we have unintentionally created a system where patients often feel powerless. They're told what they have, they're given prescriptions, but they're rarely given an understanding. They're rarely given a roadmap. They are rarely taught why their disease developed in the first place, and they're rarely empowered to take control of their own health. That realization changed everything for me. In 2018, I took a leap of faith. I had to start over. I founded Reveal Vitality and Longevity Institute because I believed there had to be a better way to deliver true health care. A simple but radical idea guided that decision. What if we stopped waiting for disease and started identifying risk before it became irreversible? What if we asked not just what was happening, but why it was happening? What if we taught patients how nutrition, sleep, movement, stress, toxin exposure, and other lifestyle factors directly influence the development of this chronic disease? Today, that is exactly how I practice. Instead of relying solely on traditional labs, we go deeper. We use personalized, precision-based approaches, including genetic testing, micronutrient analysis, cardiometabolic biomarkers, and environmental toxin testing. I pause. We look upstream, and we involve patients in the process. The results can be profound. I've seen patients reverse metabolic dysfunction. I've seen patients regain energy, clarity, and hope. But what has moved me most is this. I've watched people go from fear to understanding the ownership of their own health. This is what healthcare should look like. But there's a problem. This level of care is still out of reach of far too many Americans. The people who need prevention the most often have least access to it. Underserved communities are often hit the hardest by chronic disease, yet they are least likely to have access to the time, testing, education, and early intervention that could change the course of their lives. This is not just a healthcare problem. This is a moral problem. Healthcare should not be a system that profits most when people get sicker. It should be a system that invests in keeping people well. If we truly want to modernize healthcare in America, then we must be willing to change what we value. We must reward prevention, not just procedures. We must reimburse for identifying risk early, not just treating disease late. We must support physicians in educating patients, not just moving them through the system. And we must build a healthcare model that gives every American, regardless of their income or zip code, a real opportunity to live a healthier life. Because in the end, the goal is not simply to help people live longer, it's to help them live better. With more energy, with more clarity, with more independence, with more dignity. If we truly want to empower Americans to have a healthier life, then we must stop waiting for disease and start investing in health. The question is not whether we have the knowledge to change healthcare. The question is whether we have the courage to do it. Thank you.
Thank you, Doctor, for your passion and what you're doing. And I also know that there's a lot to be said about you really do everything you can for children, especially children that are disadvantaged. So God bless you. I want to run through Dr. Davis. I want to give you an opportunity because you've worked with patients and a lot of different patients in this region in terms of a lot of the things that you're putting in place. In terms of the longevity component, prevention we've talked about, how do you explain what that means and how does that play out with your practice?
Oh, thanks for the question. I think one of the points that I want to make in that 5 minutes that we had, it was tough to try to decide what to put in 5 minutes. But let me, in my opinion, what I've been working on for the last 4 or 5 years, and I kind of stumbled into this. I wasn't looking for this, but at the end of the day, chronic illness, longevity, I would say that 90+% of all chronic disease is caused by toxins that we're exposed to in our environment. There's a lot of talk about this, okay, but we don't really have to talk about it. I can't see behind it, but by show of hands, I would like to know how many people have even had an environmental toxin test, metals, plastics, insecticides, pesticides, things like that. And I can tell probably behind me and I can't see, not many, right? And at the end of the day, when you do testing like that when I do it on every single patient that comes through my door right now, okay, it makes the conversation very easy because those toxins, those pesticides, that glyphosate, that atrazine, the metals, the mercury, those are the things that we see that cause oxidative stress that actually contribute to chronic illness, and it diminishes our longevity. And what about longevity? Longevity is not living longer. It's thriving. It's taking care of your grandkids. It's being active and being able to do the things that you were doing when you were 30 years old. But what causes the problems there? That's inflammation, oxidative stress. That's all driven by things that we're exposed to. And in my practice right now, it is crystal clear. I don't have any more, it's crystal clear. And I look forward to the day when I could actually share all of that data. Share the data on what we really see in each and every one of us, including myself. What we see that's in our system that's causing these diseases. So we have to wake up. We have to wake up and we have to start looking at where the true causes are.
Dr. Davis, you made a significant shift in your career, moving from a reactive intervention cardiologist to focus on longevity medicine and stopping heart disease before it developed. As you work to identify the root causes of these conditions, you've talked about it some earlier, but how do standard insurance and Medicare actually cover for some of the early detection screenings that you need for your patients? And what works and what doesn't work, and what specific policy adjustments should Congress consider to ensure that our financing models prioritize the kind of regular prevention over late-stage expensive surgeries?
Well, thanks. It's a great question as well. I think part of the issue is the testing that we do. I think let's just use heart disease, for example. And we'll talk about cholesterol, and we'll talk about when we go to the doctor, we get our cholesterol checked. And the cholesterol is your total cholesterol, your LDL, your HDL, and your triglycerides. Well, we know that there are much more advanced tests these days that look at the type of cholesterol you have, the size of the cholesterol particle, so whether that cholesterol particle is oxidized or not. Those are the true type of cholesterol. That's the cholesterol that actually gets involved in the vessel wall and causes heart disease. But many times that testing is not covered by insurance. Now, things are getting better. There's a molecule called lipoprotein little a, which is a direct independent cause of heart disease that for years, I've been measuring it for 10 years now, but for years it wasn't covered. But it is a major risk for heart disease. So it really starts with getting insurance companies to cover testing that truly is upstream and is going to show us where the true risks are. I mentioned before environmental toxin tests. I mean, unfortunately, the people who come to see me, I don't take insurance in my practice, but the people who come to see me, they get environmental toxin testing. I can show you the mercury. We can do preventative screenings all day, but the mercury that causes the heart disease, the mercury that causes the Alzheimer's, the mercury that causes the cancer, like we have to start way upstream. Screening is great, and we have to do screening. But true prevention starts at the root.